what happened that I fell
You fell, yeah. You fell twice.
down those stairs.
Mary Lopez is 86 years old and has dementia.
The good thing is you didn't break any bones.
Her close friend and caretaker, Yvette Perez, visits her multiple times a week in Rosarito, Mexico.
Oh, you fell down the stairs once, and then the other time you fell in the apartment.
After those falls, Perez says they needed a place for Lopez with 24-hour care.
We did think about some of the centers that are in the States, but she doesn't have family that is in Chula Vista, and she has many friends here. And so we decided with her brother that we would check out some of the facilities here in Rosarito.
They settled on Serena Senior Care, about 30 minutes south of the San Diego border. It's a fraction of the price of assisted living in California, but also comes with obstacles.
Well, first, it's another country. A lot of Americans are not used to going to another country. The language is different, the food is different. It's hard enough moving from home to an assisted living. So to do that to another country, it can be very, very confusing for people.
And she says most U.S. seniors have Medicare, which covers their health care costs, but not in Mexico. So they still have to cross the border to see a doctor, get prescriptions, and go to the hospital.
What if it's an emergency? Then do you pay for a private hospital flight? Or do you pay for an RN to accompany you here to a hospital?
Shorkin adds there aren't the same regulations on assisted living centers in Mexico as in the U.S. But that hasn't deterred Serena's residents.
I like to think that I was smart. Lower cost of living. I was running out of money before I ran out of months. And then here, the cost of living is so good, I now run out of months before I run out of money.
Peter Fowler is 93 and has been at Serena since it opened 10 years ago. He says he doesn't mind the added hassle of living in a different country.
I go back there occasionally to see my doctors and dentists, but then I come right back.
That it?
Yvette Perez also took Mary Lopez to a U.S. hospital when she fell.
The first times that she had fallen and hit her head, I drove her across, and we went right through the medical lane. They let us just go through there.
That's a special lane at the border crossing for medical emergencies. For smaller things, Lopez gets routine medical care at Serena.
Any other thing that she might need, like medication-wise, little things, they have monthly visits here, doctor visits, and they have nurses on site.
One other complication, Perez says it's hard for Lopez's family to visit. But despite the extra challenges of living in Mexico, she says Serena is the best option.
You like the food here though, huh, Mary?
Yeah.
Yeah, you told me that you like the food.
Yeah, it's okay. I'll probably gain weight by the time I leave.
Claire Trageser, KPBS News.